First, let's go to a quick report on the counties. As you know, I set a goal of 50% of the state's population being vaccinated by July 30th. I'm pleased to report that Bradley County has exceeded that goal of 50%. We have a number of other counties that are close to that, but we're still a ways away from a goal at the end of the month. But we congratulate Bradley County for being the first county to reach that 50% goal. And now let's go to the case report for today that shows at the very top that we have 270 new cases in the last 24 hours. Our active cases have gone down some. Our deaths are 6 additional Arkansans have succumbed to COVID-19. If you look at the hospital data, and of course that tells the largest story, that we had a 55 increase in hospitalizations, 55. This is the largest increase in hospitalizations since January. It is the largest increase in hospitalizations since we've had the vaccination available to prevent hospitalizations. And we have 55 added to the hospital rolls as a result of COVID-19. As Dr. Romero points out to me, that the cases are down a little bit, but the obvious reason is, or presumptive reason, is that yesterday was a holiday and this weekend has been a holiday weekend. So we'll stay tuned for the rest of the week, but the hospitalizations obviously tells the story for today. And so today, vaccines are available and ready and accessible by everyone in Arkansas. Vaccines are here and available to prevent COVID-19, but our state vaccination rate is lower than the national rate. And while we have 1 million fully vaccinated in Arkansas, that is not high enough to prevent more cases, more hospitalizations, and more deaths. And so while we were winning this battle in April, when we were down at a very low level in all of those categories of cases, hospitalizations, and deaths, we are losing ground in July. Why is that the case? And let me talk today about the Delta variant, which is now up to 50% of the cases nationally are from the Delta variant. And if you look here, it shows the growth of it in Arkansas. The Delta variant on the left, it was in an early time frame, and that was in May 31st. We had a very small percent of our cases up there. These are the variants that are available. So the blue is the B117 or the UK. You can see the Delta, and then the yellow is the Brazilian variant. And then you have the South African that's red, that has just a little bit that's in the third bar graph. But as you can see, just I want to concentrate on the Delta graph though, as in each time frame from May to June 7th is the second graph, the third graph is June 14th, the next one is June 21st, the next one is June 28th, and then the last one is July 5th. So you can see the growth of the Delta variant as compared to all the other variants in Arkansas. And of course, the Delta variant is more transmissible and is more virulent than the other variants and the original virus that we saw here in Arkansas. The good news is that the vaccine is effective against all of those variants, including the Delta variant. It has a high level of effectiveness to prevent the actions of the Delta variant, even though it is more transmissible and more risky in terms of health outcomes. And if you go to the next one, I want to make a couple other points about where our hospitalizations are coming from. This graph tells you the average age among those hospitalized due to COVID-19. And this is from November 2020 down through June of 21. And of course, on the left side is November of 20, and then it changes to the right side, which is June 21st. But if you look at the average age back in November, the average age was 63, almost 64. And it continued that way until it started dropping. And of course, it started dropping when the vaccines were out and were being administered in our nursing homes and to our elderly populations. And it gradually decreased where the average age is 10 years lower over here on May 21st. So now the average age is 54 of those that are going into the hospital as a result of COVID-19. You go to the next graph and you see those that have succumbed to COVID-19, the deaths as a result of COVID-19, and you see the same pattern. The average age for death on the left side is 78 years of age, and that declines over on the right side to 66, average age. And so you see hospitalizations and deaths both are hitting at a lower age because the higher age groups are getting vaccinated and they're protected, and we've got a gap there that we need to work through. And so there's two specific additional strategies that I want to talk about today. First, I am asking employers in our state to take a leadership role in encouraging vaccines in the workplace. Now, let me emphasize, the employers were the first ones to push us, saying we need the vaccines, we need the vaccines. They've done an incredible job of leading and getting their workplace vaccinated early on during this pandemic. But we need them to come back and to reemphasize the need for vaccines in the workplace. First of all, I'm asking the employers in Arkansas to give paid time off for workers to get vaccinated. Paid time off for workers to get vaccinated. And then secondly, to increase access to the vaccines in the workplace. If we need a clinic there, we'll make that available. If you need greater access and you want to have something at the workplace, we'll work with you to do that. And then there's a lot of hesitancy out there, and so we need the employers to be engaged in informing, educating, and answering questions. This will help us a great deal. We're not mandating anything. We're asking for partners and help through the employer community.